As you probably know, I drove up from Huntington this morning, and you never quite know exactly what you're going to drive behind, or that there might be a train or a few things like that. So I appreciate your patience. I certainly didn't intend to be a little bit late. I expected to be on time. And I appreciate the opportunity to share with you all today. I'm not sure that we've been introduced before, so I'm going to take a minute to make sure you understand who I am and from where I come from, and that will help you to understand why I feel very connected to this community. First of all, I graduated from a local high school in Cabell County, and grew up not, maybe like some of you all, not being sure exactly what I was going to do in life. I thought you might picture, I thought I might be a basketball player when I was in high school, and I didn't really think about what that career would be for me. Fortunately, a hometown pharmacist took me under his wing and saw something in me that I didn't see in myself, and encouraged me that healthcare might be a place for me to make a difference. The only thing I did realize at that time is that I wanted to make a difference for other people. And I believe the same thing that led me into a healthcare profession journey is the same thing that brings you to working at Pleasant Valley Hospital. And that is, we want to make a difference for other people. We could do a lot of things in life. We could do a lot of different things in our journey in life. But we all collectively have chosen to make a difference for other people. Now, my journey took me first to pharmacy. I thought I was actually going to design drugs and put it into human beings, and so I decided I needed a medical degree. As I went through that medical degree, went on to my training outside of the state at the University of Cincinnati. One of the best choices I made, perhaps a choice that you all made as well, is that I married a West Virginia woman. Perhaps you married someone from West Virginia, or at least someone from these communities around West Virginia. And because of that, it became very clear to me that if I wanted to pursue something different out there in the rest of the world, I could do that. But if I wanted to see my kids and my wife, I better come back to West Virginia. So I made that smart move and came back, and it was the second best move that I made in life after marrying that West Virginia woman, because that journey has led me through academic medicine, academic pharmacy, executive leadership. I've learned executive leadership skills through that journey, through the medical school, through the pharmacy school, through the combination of the healthcare systems in Huntington. That's what gives me some credibility to be able to lead what we now understand to be Mountain Health Network. That's just my journey. I'm not saying that to impress you. I'm just saying that's where I come from. My wife's family actually grew up in this community. So not that any of you all remember back to those times, but my wife's grandfather was a Methodist minister in Henderson, and their family grew up here. And her uncle was Barry Nash, the same person of the Point Pleasant High School team who went on to be claimed in the tragic plane crash of the Marshall University football team. And so we have a long-standing, through my family, we have a long-standing relationship with this community. In fact, just by circumstance, and not to reveal any HIPAA matters, my wife and her mother are driving up here to Pleasant Valley Hospital today, this morning, probably right now, to visit her brother, my mother-in-law's son, who happens to be hospitalized here at Pleasant Valley Hospital. So I'm saying to you, we have a very clear connection to this community. We very much understand what you are trying to do here. We have always felt, I have always felt, in the 32 years that I've practiced medicine in Huntington, practiced both at St. Mary's and at Cabell Huntington Hospital. Over that career, I have received many patients who have come from Pleasant Valley Hospital, many patients who lived in Mason County, many patients who lived in the counties around Mason County who have come to Huntington for their care because that was the higher level of care that they needed. I've appreciated that. We have always felt, I'm expressing it both for myself and for Mountain Health Network, we have always felt that Mason County and the surrounding counties are part of our family. We really felt that. I've explained to you why I feel a personal connection, but I'm saying to you as a physician, as a practitioner of Mountain Health, now leading Mountain Health, we understand Mason County to be part of our family. So it's a perfect relationship in a way that Mountain Health Network would acquire Pleasant Valley Hospital. That just fits perfectly with where we think things are going. It fits perfectly in a regional delivery of healthcare that Mountain Health aspires to be. You know, we are right now a growing, I would call it an amalgamation of assets, and Pleasant Valley is now part of that amalgamation. We plan sincerely to become a network integrated across the entire region. So just as we're talking with you all and I'm having this conversation with you, we have a similar conversation and dynamic with, let's say, Logan Regional Hospital, and another conversation with the Appalachian Regional Hospital System down through Eastern Kentucky and all those places. Just as we, as an example, talk about pediatrics and the Hoops Children's Hospital, we believe that that hospital, that children's hospital, is an incredible resource across this region. So if kids get sick in your communities and need that higher level of care, we know where it's going to be. If they get sick in Eastern Ohio, Southeastern Ohio, or Eastern Kentucky, or down in the coal fields of West Virginia, they know that they can come to Huntington to the Hoops and get excellent care. And that was just exampled in a very bold way in the last 3 weeks, while, as you know, respiratory syncytial virus, RSV, is moving through the entire country and children across the country. And because of that, there's a stress upon children's hospitals across the country. There was a stress upon Hoops at Cabell Huntington Hospital. We're stepping up to meet that need. But my point is, I personally believe that, and having been a parent and now a grandparent of very small children, that disquietedness, that uncertainty when your child is ill and you're not sure what you're going to do next, being able to come to a hospital, a children's hospital with all of its resources is really valuable. That doesn't mean they can't get their first line of care in this community. And let me just say that RSV is not an illness of children only, it's an illness of adults. I had because I still have them. I have a 101-year-old patient who suffered RSV infection, was hospitalized just 2 weeks ago in Huntington. So there will be adults with RSV. And while I'm on that topic, let me just say, I have been in this position now for a year. I was asked to consider this, and I accepted the position just about 1 year ago as the CEO for Mountain Health. What have I learned in the past year? Now, I've learned a lot of things, but one of the things that's really been impressive to me, and I'm including you all in this feeling of the impact of this, is that we do really meaningful work. We do really meaningful work. Now, I know some of you are sitting there thinking like, Doc, you know, you should have realized that like when you started to practice medicine. But I'm saying I didn't take in the totality of providing the breadth of services that we provide now with Pleasant Valley Hospital across an enormous region around us. That is a lot of meaningful work. We have a common purpose, and the common purpose is to make a difference for other people through healthcare. We now have a shared destiny. Whatever happens in Mountain is going to be happening at Pleasant Valley. Whatever happens at Pleasant Valley is going to be a part of what happens at Mountain. We now have a shared destiny together, and I'm very encouraged by that. I'm very uplifted by that. Now, let me just speak to a couple of points that I think are important to put on the table. These are challenging times in healthcare economics. These are really challenging times in healthcare economics. If you were to read the same literature that I read on a common basis, you would understand that over 50% of the hospitals and hospital systems in America, not in this region, not in this state, not in Ohio, Kentucky, and West Virginia, in the country, over 50% are in the red. They are losing money. Now, there are a lot of reasons for that. And it's not a blame game, it's not anything. But if you add inflation and supply chain dynamics, you add workforce dynamics, you add salary, market-based salary adjustments, you add all that together, plus some of these restrictions that we're feeling from third-party payers, whether it be people like Blue Cross and Highmark and Aetna, or even government payers, this is a really challenging time on the economics of healthcare. Again, I'm just being truthful with you. So just as we at Mountain have a negative year last year, 50% of the hospitals in this country are in the same situation. Pleasant Valley Hospital's in the same situation. So we didn't, we have eyes wide open. That's where we are today. And we will manage that. I'll come back to that in a minute. We will address that, and we will address that with Pleasant Valley Hospital as part of our family and move forward. But I am saying to you, this is a different time. This is a different time than it was pre-COVID, and it's not really just because of COVID. It's because of a lot of dynamics that are at play. Now, our onboarding here has been really, really positive, and I want to capture something in that. About a year ago or so, when it became clear, at least clear to me, that this new relationship was going to happen. Now, it's the road to change is always bumpy. So here we are today talking about it, but I'm just saying that about a year ago is when this whole conversation began about how Pleasant Valley would come into Mountain. We've had a team of about 20 people. 20 executives from Mountain Health have been on this campus at one time or another. I've known John for a long time. They've been here from pharmacy. They've been here from revenue cycle. They've been here in terms of clinical things. They've been to the rural health clinic. They've been interacting with the executives. They've been across the spectrum. They've been here with HR. Almost anybody I see that I can remember exactly what their work area is, those experts have been there. We have assessed this. This was not like, one day we just turned on the lights and now we see what it is. We've understood what needs to be done from our viewpoint here to make everything successful here. So we are looking forward to, those 20 people have put a lot of time and effort into what we now call the 100-day plan. The 100-day plan outlines the kind of things that need to happen in order to continue to grow Pleasant Valley Hospital, to meet the needs of this region, to turn this to a positive economic view, and we're ready to do that. That 100-day plan is now being rolled out to the new Pleasant Valley Hospital Board. So maybe just a minute on that whole transaction. When you purchase something, you have the opportunity to change things. And part of that change may be the things I'm talking about in the 100-day plan, and part of that change is to change the Pleasant Valley Hospital Board. We didn't do that with animosity. We didn't do that with, with bitterness. We did that with the Pleasant Valley Hospital Board made the transaction possible, the previous board, and it's now time to move forward with a forward-thinking board into the future. Not that the old ones weren't forward-thinking, but you understand where I'm at. The opportunity to create real change in this community around healthcare, that's where we're going to be. And so that board is right now looking at a lot of things. They're looking at the budget for next year. They're looking at the 100-day plan for next year. They're trying to understand exactly what Mountain Health is bringing to this facility to work with you all on those things. And I'd be happy to answer questions about that. So we are very encouraged by the 100-day plan. We feel that this is a way to move things forward. But let me just say for a minute that while change is necessary, there's some really rich assets of this institution. I actually think the building we're in now and the people that work here is a really rich asset. I remember the first time I walked into this facility and thought, as an example, it's a really rich asset. You should know or should be aware, or I'll help make you aware, that I've known many of the physicians that work here for a long time. Dr. Ayers and I went to medical school together. Dr. Hawkins and I know each other for a long time. Dr. Dameron and I, well, if you see Dr. Dameron, when you see Dr. Dameron next, remind him that you met Dr. Yingling today. And Dr. Yingling was very proud of the fact that he hit more home runs in Little League than Dr. Dameron did. You'd be willing to do that for me? Yeah. Now, I would say if you're going to do that, at least stand back about 10 feet because his head will explode. and then he'll argue with you about that. But that's my way of saying Dr. Dameron and I go back a long way. I have appreciated Dr. Grandia's work for a long time. I mean, again, I have had a lot of connection to this community. Tess Simone was raised up in our system, and I remember recruiting Tess, and I know her family, and I can go on. My point here is that we have every reason to respect and trust those individuals to help move this community, healthcare community forward. This is not a matter of change completely. This is a matter of grabbing hold of the assets, growing them to the next level, and moving this institution forward. I think it should be recognized by you all, and I wish I could be more specific about this. I would say that others in the room, HR in particular, will be able to be more specific about this as we move through, but we understand that there needs to be movement with regards to market comparable wage for the employees of Pleasant Valley Hospital. We understand that. I will say that the initial steps were how do you right size the starting wage for employees coming into the institution, and then you move to how do you market compare and move the rest of the workforce to a similar adjustment. That's in process. So for instance, how do these things happen? Just mechanically, how do they happen? Well, you put together a budget. Then you have to have the board approve the budget. Then the other board has to approve the budget. In the meantime, HR has to be working on that. And how do you disseminate those decisions across the entire workforce? All I can say today with clarity is we are going to do that. The mechanics of that, the specifics of that, I don't have the opportunity to be able to speak to you today about that. But I would hope that I would see heads shaking that is in process and that we plan to be earnest about that. And I'm open to those questions about that in a few minutes if those questions are still there. In that 100-day plan, I'm going to speak to a couple of specific things. We realize that we have a very good general surgeon. We're very encouraged that he's back to work. I know you all are appreciative of that. He's not just a good surgeon, he's a good person. We're glad that those issues are taken care of and he's back. To support that, we've brought Dr. Rubenstein, another really good, well-trained general surgeon, to begin to work here. You'll recall that you had two good general surgeons previously in terms of their work, and we'd like to bring back that and make that more robust. Soon there'll be an otolaryngologist or an ear, nose, and throat surgeon practicing here. We're very encouraged by that. We look forward to the Marshall Health gastroenterologist being here and doing a lot more gastroenterology procedures. Now, I just have to speak to the matter as a practitioner that it has been my experience in the last 3 years that many of my patients have deferred a lot of primary care, preventative care procedures that should have been done during that time. And you all probably will also recognize that, unfortunately, if you're on the cancer side of matters, we've seen too many advanced stage cancers that are probably the result of not having proper screening during that time frame. Now we'll have the opportunity for those primary care physicians of the rural health clinic to be able to extend the opportunity to their patients to have timely procedures done. Now, just to put this in perspective, and I'm just using their terms, not mine, okay? So I'm just saying what the gastroenterologists say. The gastroenterologists say that they believe that there's enough unmet need in the population of these communities that once they're here, they should be able to do 100 GI procedures a month. In fact, they say very shortly it would go from 100 to 200. Now, you can say, whoa, doc, that's a lot of work. Well, it is. First of all, the community needs that. It's the right thing to do for Mason County and for the surrounding regions. It's the right thing to do to move this hospital in a positive way. It is going to be work, and as the workload begins to develop and we begin to appreciate that, then we will right-size everything that's needed to meet that. Now, I understand that a lot of people, whether I get the cart in front of the horse or whether you think the horse is in front of the cart, we'll work this all out. We'll work it out. We'll make sure that the workload and the staffing and all those dynamics are right-sized. But I'm very encouraged by the fact that those things are coming to Pleasant Valley Hospital. And I could probably go on for a few more of those. I don't want to take the whole time talking about that. we were very encouraged about what Marshall Health brings to this arrangement. Marshall Health will bring the opportunity for graduate medical education on this campus. Let me just pause for a second to just highlight that if need be. It is an important thing across America to begin to train physicians or further the training of physicians in rural places in America. Now, I hope it's not a surprise to you, but people think Point Pleasant is a rural place in America. Anybody going to argue with me? Okay, no, okay. But to my point, as an example, Marshall Health just recently achieved the first accredited rural surgery training program in America. The first accredited rural surgery training program in America. So I've just spoken to the fact that we need surgeons who are trained and want to practice in rural America. The value of a general surgeon in hospitals like Pleasant Valley Hospital and others that I named, like the Appalachian Regional Hospitals or Logan General or those places, that they train there, they understand what it means to work there, what they understand their limitations might be, they understand how to work in that environment, they want to be in a small town America. That's really valuable. And so Marshall Health has achieved that. The first program to be approved is at Logan General, or Logan General Hospital, Logan Regional General Hospital, whatever their name, Logan Regional Hospital. That's only because in my lifetime they've changed their name multiple times, I think. But back to the point. We would like to extend those kind of things here. So for instance, in the rural health clinic, it would make great sense, whether you talk about a general surgery program, if you talk about family medicine, you talk about internal medicine, raising up the next generation of physicians who feel very comfortable and work in the environment just like Dr. Hawkins, just like Dr. Ayers, just like others already there, Dr. Living. That's really important to grow the workforce for the future. It's those kind of things that Marshall Health can bring. They can bring those gastroenterologists. They can bring other services. So we're very encouraged that Marshall Health is very much part of the Mountain Health Initiative here at Pleasant Valley Hospital. Maybe I'll pause there for a minute and see if you all have any questions before I jump into something else, move into something else. Nobody has any question for me? No one has any concern for me? Not even one? Not even? I don't know, Jeff, Craig? Anybody have anything they'd like to add to before I look over my notes and see if there's anything I didn't cover in my interaction? Thank you.
So there's lots of references to the 100 plan. 100
Yeah.
plan. Does that get disseminated down to everyone to know these are all the initiatives, or is that something that comes along gradually, or how, each phase, is there phases to it?
Right. So I think that the way that I've learned the terminology I would learn is how does that cascade through an organization, right? So again, the way these things start is that the previous board had expectations of what they thought should happen in this acquisition. And we, Mountain, Marshall Health, tried to meet whatever those expectations or properly set those expectations. Then as the 20-member group is on campus, you begin to more granularly understand what those have to be. Like, how do you begin to address revenue cycle? How do you begin to address the rural health clinic? How do you begin to address the emergency department? And so out of those, just so many things, supply chain and whatever, almost anything whatever you all represent as you sit here, I guarantee you somebody's had a hand on whatever that is. You then organize that into what really fits in 100 days, 6 months, 1 year. Then you take it from kind of general understandings down to specific understandings. And that's where we're at now. We now have very specific goals, if you will. That's shared with the board. The board begins to understand that. And in fact, we had given the new board kind of the general overview the first time. They are just now at this upcoming board meeting, which is next Monday, the first kind of organized board meeting, would be the 100-day plan. So they begin to look at it, and they begin to give their advice or their feedback about that. At that point, we then begin to cascade through the organization. So many things I speak about today, at least the way my mind thinks about them. When you're setting a strategic plan, most people use, and you're going to have to forgive me at times because I am nothing but a dressed-up teacher, quite frankly. So I'm now about to teach you about something. But most people feel that in strategic planning, one of the paradigms that they use is called GHOST. It's you have a goal, you have an objective, you have a strategy, you have a tactic. Now, those tactics, some of which I've already shared with you, the tactics for that strategy, which would be expanding healthcare services from Pleasant Valley Hospital across this community. One of those tactics would be growing general surgery. One of those tactics would be adding gastroenterology. One of those tactics would be advancing ICU coverage in the hospital with telehealth for ICU care. That's a tactic of a strategy, of an objective, of a goal. And that's what we're sharing with the board now. So that will cascade through the organization. Now, some of you all, again, have already started to feel some of the tactics and the strategies. So for instance, when someone like Fareed Aziz is on campus and talking about how do we improve revenue cycle, how do we do this, how do we do collections, how does Mountain Health do this effectively, and you all are willing to listen and accept that and begin to implement that, that again is part of that plan. But to your point, I think soon after this board meeting next Monday would be the time to cascade this across the institution so that they would understand that. But maybe I'll take another few minutes on that. One of the things that in the listening tour of the last year, and I believe that's what I've tried to do, is to listen to what are they saying about Mason County? What are they saying about Pleasant Valley Hospital? What are they saying about the needs? One of the things that became very clear was that how organized, how effective are ambulance transfers, EMT services across our community. So I think that that's really important. I mean, that's really important for those of you that live in Mason County, Jackson County, northeastern Putnam County, northern Cabell County, even in Gallia County. If you live outside of that, I mean, I hope you have good ambulance services there because I don't have any influence there. But I do have the opportunity to have some influence here. We have had, just as an example, we have had very fruitful conversations with both the Office of Emergency Management and the local EMS services through the county commissioners to talk about how do we bring better services for that. Now, I'm going to dump a whole lot of stuff onto this because I think that's really important for anybody who lives in this community. They should be able to expect that they're going to get emergency services when they need them. That's one. Two, you should expect that your hospital, the hospital you work in, has a high quality emergency medical service operation in the hospital. So we will be focusing time and energy on that as part of the 100-day plan. In fact, as you all know, it's the portal into the hospital. It's the way most people get into the hospital coming through the emergency room. Yes, I do, and some of us do admit patients right out of our offices, and I'm sure that the Rural Health Clinic does the same, but the vast majority of them come through the emergency room. So there needs to be a very efficient emergency room as another touch point. How we organize that across this region is really important for another reason, and I'm going to get to that, and that is the amount of economic development that's going to arrive in Mason County in the next few months and the next few years is enormous. I mean, you all will have a lot of new neighbors and new friends, and your communities will feel that, I would say, not just economic development, but the opportunity for prosperity in Mason County. Now, if all those people are coming here, then I would just propose to you, if they're anything like the patients I've taken care of, they're going to fall off their ladders, they're going to cut their hand on the lawnmower, their kid's going to fall in a ditch, they're going to break their leg at the football game. Whatever it is going to happen with a whole lot more people here. And we need to be partners with how all that care is going to be provided. So we are keenly interested in how we grow emergency services, ambulance transports, engage on that, support that, not just for today, but for tomorrow when all that's happening. And if you talk to the people, it wouldn't surprise you, when you talk to the county commissioners, as I have, and I've listened to them, they are quite aware of what their responsibilities are going to be. You know, what their community services responsibilities are going to be, and we, Mountain, we, Pleasant Valley Hospital, we need to be part of that. And so I'm just saying that's another area to think about in the 100-day plan, in the 6-month plan, in the 1-year plan. We are there, we're eager to be good partners in that. I'm sorting through my mind whether we want to continue to share. I'd like to hear from you all, though. I mean, any feedback to me today about where things are in your all's minds? This is where you hear me, and I'm supposed to hear you. Not just that you're going to fill out the evaluation form. Really? Not even one little tiny question?
When are the ER renovations going to start?
Yeah.
We've heard that there's going to be big changes out there.
Yeah. So just kind of walking through that. So you kind of come and make your first assessment, and you know, it didn't surprise you or anybody in the room that you know it's you got to go uphill to get to the emergency room, and is that appropriate or not appropriate? And you know, there's a lot of logistical things to think about. Then you have to have the architects come and take a look at things. Then you have to have the architect's plans, and then you have to figure out how much is it going to cost to do that, and then how do you properly target the right time for starting those things. Are there blueprints for that? Yes. Is the timing of that going to need to be very strategic? Yes. Is it clearly part of the 100-day plan? Yes. Can I tell you today that it's going to start December 16th at 10 o'clock? No. I do think that those kind of things are planned for 2023, and we will be moving earnestly towards that. But there's a bit of, right now I'd say it's more of a timing issue than it is having all those pieces in place. I mean, I hope that helps to give some answer to it. It's a concrete initiative. It's not, well, I shouldn't use concrete when we're talking about building, but it is substantiated by the fact that those people have been on site, have provided those plans, and we look forward to moving on that. Yeah. Other questions that you've heard, or rumors, or you're not as tall as I thought you were, or oh, sure. Thank you. Is the name going to change? I was saving that for last. Well, first I'm going to say we appreciate the fact that many of you filled out the survey that was part of that question, like what source is that? I would say to you that we have surveyed the community, the leaders of the community, the employees of Pleasant Valley Hospital, and there's a pretty good clear picture that that is going to be important in terms of brand and imaging for the future. Yeah, we understand that. And in fact, that's part of the 100-day plan. And I would share with you that the Chief Strategy Officer for Mountain Health, her name is Lisa Chamberlain-Stump. Some of you all may have met her. She was part of those 20 people that I mentioned. This is really their expertise, right? There's certain things you can ask me about, and I probably have an expertise for them. I don't know, so maybe something about medicine or pharmacy. When it comes to these kind of things, I'm probably not the right person to be responsible for it, because I'm not creative enough, I'm not visionary enough, and I don't know the process well enough. But I would say the process has already begun. So that committee of the board has already begun to meet and begin to talk about what that's going to be. There has to be an engagement across the community. There is a proven methodology to use to get proper buy-in, to get proper understanding, to get moving towards what is the right name. Should it remain the same? Should it actually change? That is already in place and moving. It should not be a surprise to anyone that there are people in this community that still anchor to Pleasant Valley Hospital. And I do understand that. There's people who said, I was born here, or my family was born here, or somebody saved my life here, or whatever that might be, that they feel, so we have to understand historically that we can't jettison all that And yet, we need to create what is going to be the right positive image about healthcare here for the future with Mountain. I'm not here to propose what that name is, and you do not want me to propose that name, because I've been through this process before. I stepped away before it became Mountain officially, but you know, I had made up names that were just no good. Yes.
Like what?
Well, you know, now that you ask me, I'll just share with you all. So as you go through we're not doing that here because you all are smart, and I think Lisa is very smart, and I think the people here can be really smart, and they can figure out what the right name is. But we hired a firm to come in and kind of tell us, like, how do you rename an institution? And I'm not kidding you. They came back with a list of names, and I promise you, it had to be some people like at a party one night, just thinking up names, throwing them on the table and saying, oh yeah, let's give them that one. But you actually would smash two words together, like Truest Health. Oh, let's call it Truest Health. And they come back to, how did you get that name? They say, well, true, it's valuable. Okay, that's how these things went. And if they asked me, I would have really, really unfortunate names. You know, they were concrete. They were heavy. They were not good. They were not good at all. So you don't want me in that process. There is a process. You all will be engaged with that. You'll see it as it rolls forward. It is part of the 100-day plan. Again, it's a tactic on a strategy, on an objective, and the goal is to create a really positive healthcare enterprise here for this region as part of Mountain Health. So, yeah. No, I'm not giving those names. Anybody else have a question? Yeah.
Insurance plans and potential changes in retirement, is that going to be included in the 100-day plan as well?
Yeah, so now this is another really good teaching lesson. Anybody remember Ronald Reagan, the president? Yeah. Does anybody remember Ronald Reagan was called what kind of president? He was the Teflon president. Nothing ever stuck to him. So you asked me a really difficult question. It isn't going to stick to me. It's going to bounce off me and go right over to that side right there. It is my understanding as of like this week, the discussions about the healthcare plan, the cost of the healthcare plan, those kind of things are really actively being discussed. I don't know if you want to.
We received the email this morning, so we're getting the final numbers back. As you know, as we go through the brokers with it, we have the healthcare plans, the dental and the vision. So we have those numbers back, so we're hoping to start open enrollment the week after Thanksgiving. Okay, and also with that, I'll let Dr. Yingling talk about our domestic partnership where things at St. Mary's and Capital Huntington, you have the same benefit as you have here now currently. What we're trying to work in to make sure you guys have other options other than here if you're a permit.
Yeah, I don't know if that helps to answer the question. Yeah, so it is an active part of the discussion. It is, we understood from the listening tour of the last year that was really an important aspect to the workforce here at Pleasant Valley Hospital, was to not jeopardize that, and if possible, to improve that. So I think that's clearly in play, and I think you'll see that roll out very quickly. Again, I mean, I'm asking for a little bit of grace. We acquire on October 1. We make the announcement on October 13. You have the first board meeting of the new board members the end of October. We had the finance committee meeting yesterday. We have this next board meeting next Monday. There's just, I understand the urgency and almost a feeling of pent-up demand kind of feeling. But I think it's in hand, and I think it's being worked through. And hopefully, if you need more details, certainly we could provide that to you. Yeah. Yes, ma'am.
Is that going to be including our PTO for holidays and all that?
Yeah, so as of right now, there's been no changes to your PTO or EIB going forward. Okay? So the policies have been in place. What you're accruing at with your seniority level will stay the same.
I mean, paid holidays from,
So right now, with the holiday plan and stuff, there's been no changes to any of our policies or anything like that. So what we're doing when we're reviewing the policies, I'm saying back to Susan Beth, they're reviewing it, making recommendations, but from our side, the things we have in place is what we like to have in place going forward, the things you guys are accustomed to. We don't want to make any drastic changes, but allow getting feedback from you guys and get your opinion.
But I think that sorry about my voice, I went to a concert this weekend, but.
You were singing?
She was featured on it.
And have holiday time, we shouldn't have to burn our vacation for that. I think that's a big issue.
Well, the way I think that because it is you know, in that review process, I think the way I would hear this is the voice that you all have about many of these matters needs to be clear so that as we make the plan going forward or set the plan, we understand what's in and what can't be in. And I think we're kind of in that interface right now. We're trying to be respectful for what's there and so forth.
The time that we need to, you guys need to let me know, because as we go forward, we start making changes. I want to make sure the changes we make as we go forward with Fountain Health is the changes that you guys want to see in place, are also the right changes for us going forward. Just because it has been this way forever doesn't mean it has to be. Okay?
And I think there's, you know, there could be some give and take there. There could be some things you get that you didn't have. There might be something that we just can't accommodate, but we'll try to figure out what the best road to that is. For instance, it just came up to, I think through HR, to me, to executive team about, I understand that there's always been a holiday gift appreciation to the staff here at Pleasant Valley Hospital. That should continue. That shouldn't change. You know, there's nothing about Mountain Health's acquisition that, at least for this year, we should change any of those things. So that might be a way of me saying to you indirectly, that'll be said to you directly, that that part will stay in place. What other questions do you have? These are good questions. This is what I would hope would happen. And as I just exampled to you, if you ask me a question that I don't know the answer to, I will deflect it to somebody who now is responsible for it. Oh, let me, well, I see Jeff's hand. I'm going to come to Jeff. Let me also say that the practice in the past has been that we would identify or record all the questions that you all have. I will try to give you an answer as best I can, as earnestly as I can today. If, on reflection, that question is then, cataloged, and we'll give an official explanation so that that can be given back to you or posted on the intranet so that all the employees would be able to see that in case they don't get a chance to be here. And your questions in this session may be different than the questions that come this afternoon or this evening. Yeah. Now, sorry, Jeff.
I was just going to ask, do you envision Mountain Health expanding much beyond Huntington and now Mason County? And if so, you have a flavor of maybe what the timing of that might be?
Yeah, so I think I hinted at that, but I'll be more declarative about it. Clearly, our and Marshall Health's movement on the I-64 corridor, what many in that region call the Advantage Valley, towards South Charleston, will continue. It's not a surprise to you all that there is a lot of competition in healthcare. What's happening in Kanawha County between WVU Health and now Vandalia, which is CAMC, Mon Health, that will consume a lot of energy, a lot of time, and a lot of money. But in the meantime, we continue to say that we have advanced medicine, compassionate care that can be brought way into Putnam County and all the way into South Charleston. We are not changing that. We will announce the beginning of January a memorandum of understanding with Logan Regional Hospital. They will become a membership partner just as you all did. Now, you all are a membership partner by acquisition. I'll just spend a minute here. There are multiple layers in which organizations can partner. You can partner on a business venture like an acquisition. You can partner on a business venture like a joint venture relationship. You can partner on clinical services lines. So some of these relationships may be a very clear business relationship. Some of them may be very clear as a memorandum of understanding and what services are going to be traded back and forth, if you will, for mutual benefit between an organization. MOU, Logan Regional. Others may be completely on the clinical realm, and some people will call those clinical service agreements. Perhaps, I'm just using Appalachian Regional Hospital, perhaps a clinical service agreement would be important for that organization. To Jeff's question, all those things are in play. I'll be perfectly honest about this. I've had many positive conversations with Dr. Canaday at Holzer, and I value those conversations. Now, I value them not like, you get this and you get that. I value them in, could there be a service relationship in which we provide from Marshall Health something to Holzer that isn't here or isn't going to be here? You know, that might be a way. So for instance, right now you all have, I believe, we have an excellent orthopedic surgeon. We need to grow orthopedic surgery here. We need to grow sports medicine in this region, in this community. That's really valuable, okay? The fact that there's a relationship with orthopedics at Holzer, is that a competition? No. I think there's lots and lots of patients in this region. We can fill up Dr. Compton and probably other people right here doing surgeries. And it's not really a competition that a specialized back surgeon, spine surgeon happens to have a relationship at Holzer. So I don't want to create the idea that, you know, I'm brokering competition. I am brokering partnerships that make sense to Mountain Health and Marshall Health, and the most important one right now is you all. I don't know if that helped to answer that or not, but that's my answer and I'm sticking to it. Yes?
I felt like this was helpful and important for everybody to have this opportunity with you. Will these be happening quarterly, ongoing? Is there like a routine schedule we need to follow?
Yeah, so the way it happens, first of all, as I shared with you, been at this for a year. What I've learned is that the town hall interactions are really important. What most workforce surveys say is there's not always a clear line of communication between the executives and staff. And that's not a criticism of anybody, the past, I'm just saying in the general. As an example, that was a criticism of the physician workforce in Huntington. And last night, I had the first physician engagement town hall conversation with physicians at one of the hospitals. It had been this year, the cadence of it had been, I had done town halls now 3 times at both hospitals in Huntington. This one happens to come at the same time of the 3rd one there. I can't imagine it would be any different here. I mean, part of it is, you know, you might want to say, do you want me to come back? You could say, I don't want him coming back. Don't come back and tell us anything. You know, so long, good luck. But that's not my way of soliciting for a good evaluation. It is, if this is useful, hearing from the leader of the entire network, then I'm open to being here. Yeah. And obviously, that's probably a different voice and a different perspective than any of the hospital's leaderships. So St. Mary's, Cabell, Pleasant Valley have their own leadership, and they have their own cascade of information that they would like to provide, but on occasion it's probably reasonable to hear what we're thinking at that level. I'll make one last point that I think is relevant to you all. And I said it before, and this is very global, so I'm very big in a sense, but at least it lets you know how we're thinking about things. So in my left hand, I have what I would call an amalgamation. That amalgamation is Cabell Huntington, Hoops. You know, I now say we have 5 hospitals in our network, but Cabell Huntington and Hoops, St. Mary's, and Cornerstone, which is a long-term acute care hospital inside of that wall. Pleasant Valley, there's 5 hospitals part of our network. In that is also all those other partners, Marshall Health, HIMG, other things that are all part, an amalgamation of things. That's where we have gotten to. We've captured that. Now, are we yet a network? No. I just told you we're bringing in another amalgamation, like Logan Regional, Appalachian Regional Hospital. What is that all going to mean? But eventually you have to work to becoming a real network of how we integrate across all those platforms to be a highly reliable healthcare organization. Now, in my mind today, there are 3 bridges that get us there. If you're following my picture analogy here, here's the amalgamation, here's the network, here's 3 bridges that go across. And one of these bridges is important for you all to hear, most important. At the top is, what's the organizational structure? So not that you need to worry about this at all, but we have multiple boards, multiple advisory boards, and this board and that board, And one of the board members from here serves on one of the board members on one of the boards in Huntington. And what's our relationship with the university? You know, what's our real relationship with Marshall University and Brad Smith and a medical school? Okay, you're kind of getting it. There needs to be a clear organizational structure for us to be able to move forward. We're working on that. Operational structure. There needs to be a clear operational structure across all of our institutions. How do we do it? How do we do it consistently and effectively and efficiently? That's another level. And then at the ground floor are going to be things like, and I think this is relevant to you all because part of that flag is planted here. Cancer services. Right now, we have an incredible array of really good assets around cancer care, one of which is here on this campus, one of which is the Edwards, one of which is HIMG and St. Mary's Cancer Centers. One of it is the incredible resource of physicians that are part of that. Part of it is everything from a pediatric oncology group at Edwards to a really robust hospice care, all part of cancer care, right? So my point is we have an enormous array of really valuable assets, of which one of them is here in Dr. Shanuda. How do we unify that? How do we bring that all together? Right now, as an example, we see about 1,500, 1,800 new cases of cancer per year. It is estimated that at least that many patients leave our communities to get cancer care someplace else. Now, I personally believe that we can provide advanced medical oncologic care in our communities. That doesn't mean you don't go away and get a consult and come back. Doesn't mean you don't go away and perhaps get a specialized surgery and come back. But we can provide infusion therapy and immunobiologic therapy and those therapies in the hometown community for the people who need that. And that's what you all are doing here through Dr. Shanuda, the Edwards on this property, and we plan to expand that. But to my point, we're trying to unify that at at Mountain Health, and that's one more bridge on that area. Just like we've consolidated obstetrics and perinatal and birthing center experience at Cabell, just as we've moved hearts to St. Mary's, just as we've moved kids to Cabell, we need to unify cancer care because there's just a huge amount of cancer care that's leaving our communities that I believe can receive excellent care right here if we do it correctly. But to the operational part, we have currently in place a consultant, and the term for that is called the Quest for Success. The Quest for Success will, over the next 6 months, make us much more efficient, much more effective on the operational side. We have to move from losing money to getting back to a positive margin, and that will help us to do that. And that, I believe, will bring benefit to Pleasant Valley Hospital. And I know that many people are involved already with the Quest for Success, but I'm reassuring you all that we have our eye on that ball and plan to drive that home over the next 6 months to a year to make it more efficient. Now, an amalgamation, a network, you're now part of it. I appreciate the opportunity to be in here to share with you all. I'm open to any other last question you might have.